Hello everyone, I'm Dr. Priyanka, consultant neurophysician at Renova Hospital's Langar House. Now, what are the symptoms of brain stroke? Brain stroke symptoms can have varied presentation. The most common being weakness of the leg and hand, deviation of the face with slurring of speech, which most of the people feel this is the only symptom patients present with brain stroke. That is not the reason. Sometimes what happens is the patients can only have imbalance while walking. That is, while they're walking, they can be swaying to either sides. Or sometimes they can only have numbness or tingling sensation in the hand and the leg, sometimes even in the face. They will not be able to feel the objects. And in other cases, the patient will simply present with giddiness, sense of dizziness, vomitings. In such cases, patients generally do not come early, considering that it is a normal thing. So, the symptoms of brain stroke can be weakness of the leg and the hand, facial deviation. Sometimes they can only have speech problems. Either the patient will present to the OPD with difficulty in speaking, or sometimes they can speak very normal, fluent, but they do not understand what they are talking. That is called Wernicke's aphasia, which is a type of stroke. So, depending on the areas of the brain which are damaged, those areas have different function, each area. So once the speech area gets damaged, the patient presents with speech difficulty. When the areas which are involved in the movement of the hand or the leg, they are damaged, then they can present with this weakness. Now, which patient develops more weakness, which patient has less symptoms, that all can only be known with further evaluation. But once the patient presents with severe weakness, then the chances of recovery depend on the time duration. As I said before, time is very important. Now, coming to the other symptoms of brain stroke are they can only have symptoms like double vision or blurring of the vision, or they will not be able to see one side of the body, like they cannot see left side or right side. In such cases, most of the time they go to ophthalmologist, considering that it's because of eye problem, but it is not. And some patients can present with only seizures, that is fits, and later it is understood that's brain stroke. So as I said previously, the areas and their functions in the brain, once they are damaged, each area has different functions. So depending on the area, the patient presents with such symptoms, but most commonly brain stroke presents with paralysis, that is weakness of the leg hand with face deviation, difficulty in talking, or sometimes they can even have complaints that they will only have difficulty eating food, liquids. They will have choking sensation, change in the voice. Rest all will be normal. So it can involve the individual cranial nerves also sometimes. That occurs most commonly in brainstem stroke, where the patient will have such symptoms of regurgitation. That is, when they have food or liquids, it comes through the nose. Or when they have food, there's choking sensation. They cannot swallow. So these are the symptoms of brain stroke depending on the areas. And apart from all these, as I said previously, only complaints of dizziness, or they can have severe headache. Headache, vomiting, giddiness can also be causes for brain stroke. So can also be symptoms for the brain stroke. So hence brain stroke can have varied presentation. But importantly, if the patient has underlying comorbidities, then the symptoms may only add up further, because the excess comorbidities, like as I said, if there are any heart related issues, then the patient may have new symptoms, because the number of clots going into the brain can also increase. So as I said, it can be slurred speech, it can be difficulty speaking, it can be complete mutism where the patient does not speak, or patient can speak but he will speak irrelevantly, or it can be numbness or tingling sensation in the legs, it can be imbalance while walking, it can be blurring of the vision, or it can be sometimes memory disturbances as well. They will have memory loss. So the area which is concerned with memory issues, if it is damaged, if there's a clot or a bleeding there, then the patients can present only with memory issues, forgetfulness. So hence, these are the complaints, clinical features, in brain stroke.